Hello and welcome to this video discussing the social determinants of health. Understanding this concept is crucial because of its profound impact on the health of individuals and entire populations. In this video, we will explore what social determinants of health are, how they influence health outcomes, and introduce a helpful framework for comprehending them. When we observe the people around us, including our family, friends, and others, it becomes evident that health varies significantly not only between individuals but also among different population groups. Let's consider an example. In 2015, the life expectancy of a child born in Sierra Leone was 50 years, while in Australia, it was 83 years, a substantial difference of 33 years. However, variations in health also exist within countries. For instance, in Australia, the life expectancy of Indigenous people is approximately 10 years lower than that of non-Indigenous people. Social status plays a role in determining health within a population. Individuals with higher income, education, and occupation tend to have better health and a longer life expectancy. Moreover, health status can change due to various factors. For example, studies on migrants have demonstrated differences in the types of diseases, health behaviors, and risk factors compared to those in their countries of origin. To understand the reasons for this variability, we must explore the factors that influence health. A person's health is influenced by a range of determinants, including individual factors such as age, sex, and genetic makeup, as well as their behaviors related to health, such as smoking, physical activity, alcohol use, and diet. Additionally, health is significantly influenced by the conditions in which individuals are born, grow, live, work, and age. These conditions encompass social and community networks, socioeconomic, cultural, and environmental factors, as well as the healthcare systems. Collectively, these factors are referred to as the social determinants of health. The social determinants of health are ultimately shaped by the distribution of money, power, and resources at the international, national, and local levels. They exert a significant influence on health inequities, which are the unfair and avoidable differences in health experienced by different groups of people within and between countries. Numerous social determinants of health operate across different levels and interact with each other in complex ways. To understand and explain how these determinants impact health and well-being, several models or frameworks have been proposed. One useful framework developed by the World Health Organization distinguishes between two broad types of health determinants: structural determinants and intermediary determinants. Structural determinants pertain to the socio-economic and political context in which individuals are born and live. They include governance, economic, social, and public policies, as well as the social and cultural values attached to health within communities. These factors can contribute to the unequal distribution of material and monetary resources, which, in turn, shape a person's socioeconomic position. Socioeconomic position encompasses education, occupation, income, gender, race or ethnicity, and social class. This socioeconomic position affects intermediary determinants of health, which include material circumstances, example housing quality, financial means for healthy living, psychosocial circumstances, example stress, relationships, social support, and behavioral and biological factors. Furthermore, health systems play a significant role in determining the type and quality of healthcare available to individuals, as well as their access to healthcare services. Factors like social cohesion and social capital bridge the gap between structural and intermediary determinants. They describe the willingness of individuals in a community to cooperate and make sacrifices for the greater benefit of all. It is essential to note that the relationships between these different factors are not always linear, they are complex and can operate in both directions. For instance, poor income and education can impact health, and poor health can limit opportunities for education and workforce participation. Additionally, when a population is heavily affected by disease, it can have broader implications for the socioeconomic and political context. Addressing the social determinants of health is a challenging task that involves identifying the structural and intermediary determinants and taking appropriate actions to improve them. This requires efforts from all sectors of society at local, national, and international levels. The specific actions taken will depend on the existing socio-economic and political context, available resources, and the commitment to implementing change. In conclusion, this video provided a brief introduction to the social determinants of health. We explored what they are, how they impact health outcomes, and introduced a useful framework for understanding them. Recognizing and addressing the social determinants of health is crucial for promoting health equity and improving the well-being of individuals and populations.